Welcome everybody. My name is Dr. Vitaly Mosesin, and today we're going to talk about common causes of back pain, non-surgical treatment options, mistakes made by both doctors and patients in treating low back pain, and just a general overview of the anatomy and things that are prone to getting injured and things that are commonly injured in the back when you start to have back problems. This is Dr. Thomas Ferrigno. He is the owner and clinic director of Bay Area Disc Centers, which has 3 locations, San Mateo, Campbell, and Palo Alto, California. Dr. Ferrigno has 26 years experience in private practice. He is nationally certified in spinal decompression. He has over 26,000 decompression treatments performed. He's a board member of the International Medical Advisory Board on Spinal Decompression, member of the Disc Centers of America, which is a national group of doctors who specialize in the treatment and management of severe disc injuries, and he's the co-founder of the disc restoration therapy method. This is one of the leaders in non-surgical treatment of back pain. My name is Dr. Vitaly Mosesin, and I am the owner of the Bay Area Disc Centers in Palo Alto, California. I've been in practice for 13 years, and I'm also a co-founder of the disc restoration therapy method. My doctorate is in chiropractic, with most of my postgraduate training in non-surgical spinal disc treatment. I'm one of 4 doctors in California nationally certified in non-surgical spinal decompression, and I was the chiropractor to the Stanford gymnastics and wrestling teams, so I've seen my fair share of injuries with these folks, great athletes. And I too live a pretty active lifestyle, cycling, resistance training, skiing, and other activities. And I realize how important it is to be at your best and not be limited by back pain. Because when something goes wrong in your back and you're dealing with chronic or even acute back pain, your life is pretty much on hold, and that's not the way to go, and we're going to talk about how to get you out. I'm also the proud father of 3 girls. Here's my family, my wife, and my 3 daughters. One of my daughters happens to be hairy and have 4 legs. So, what is our purpose? Our purpose is to offer Bay Area patients and beyond suffering from chronic disc disease a safe, non-surgical, non-invasive solution to their chronic back, neck pain, resulting in a better quality of life. And this is what it's all about, getting a better quality of life. And this is all from a medically integrated team. From the standpoint of a medically integrated team, we have medical doctors on staff, we have therapists, we have chiropractors, and we work as a team to figure out the cause and pursue treatment of back or neck pain. So how will you avoid surgery? Unless you've already had surgery. That's the question. How many of you guys have had low back pain, neck pain, radiating pain down your arms or legs? How about tingling or numbness in your hands and feet? What about weakness in your arms, hands, legs, or feet? Or the most common complaint that I hear in my office is, "No, doc, I'm unable to stand or walk for long periods." I'm sure you guys on the other end of that screen are nodding, and that's why you're here. So this is exactly what we're going to go over today. How many of you guys have been told you have disc herniations or bulges, sciatica, degenerated disc disease? How about spinal canal stenosis? And over here on the right, you could see the illustration of all of the conditions that I mentioned. You have a normal disc on top. Disc can get deteriorated over time. A disc can bulge. A disc can herniate. And as you get down, you get a thinning disc where the bone gets way too close to the other bone. And then you get disc degeneration, where one bone is on top of the other, causing osteophyte formation. And unfortunately, at that point, you are managing a problem that you're never going to fully reverse. So it's really important to find out how to not get there. And if you are there, you could still get some help. So we'll cover all that today as well. How many of you guys had MRIs or X-rays of your current complaints? Anybody ever visit a chiropractor or go to get acupuncture? How about epidurals, cortisone injections, physical therapy maybe? And how many of you guys have even had surgery? Over here to the right you'll see an X-ray with a pretty extensive surgery. And folks, this is what we want to avoid. Life is never the same after this. And if it's something that you've already had, there's also a little bit of hope. And we will touch on that. So the big question is, how many of you guys are still suffering from the same chronic back pain, given that you've tried all of this stuff? And again, you're here, you're probably nodding your head on the other end, and I just want to say that you are not alone. So, let me give you some stats on low back pain. Low back pain affects about 80% of Americans at some point in their lives. It's the most common disability among people under 45 years of age. It costs more than $100 billion annually in the United States, and over $20 billion of that is due to spinal surgery. More than 1 million Americans undergo back surgery yearly. That's a staggering number. This rate has doubled that of most developed countries and 5 times that of the United Kingdom. Speaking of surgery, in this New Yorker article over here, they found that 72% of people that have had their first surgery needed a second, a third, and a fourth surgery. So it doesn't usually end with one, folks. So one would ask the question, are we on the right track? Why is back pain becoming such a problem despite having the best surgeons, the best medicine, the best doctors in the world? Is it possible that we're kind of going about it the wrong way? I would say yes. So let's talk about why. And it all starts with figuring out what is the primary source of back pain. What is the number one source of back pain? And most specialists, including myself and Dr. Frigno, believe that 75% to 80% of chronic back pain and sometimes acute injuries stem from the spinal discs. And over here on the right, you see a spinal disc in between two bones. And we'll go over exactly what that is, how it gets injured, and why it causes pain. But this is the most common cause. We've seen it in practice, and before practice, this is something that physicians before us came to the conclusion of. So what are two primary things that can happen to a disc? A disc can degenerate, meaning a disc can wear out, or a disc can bulge or herniate. So you might have heard the term slip disc. So what is a disc? Okay, a disc is made up of something called an annulus fibrosus, which surrounds a nucleus pulposus, which is a jelly-like substance. And the disc acts as a shock absorber in between the spine. And it acts as a spacer in between the spine. And it allows for the absorption of pressure and motion in your spine. The disc is made up of about 86% water. It has no blood supply, and there also are not any nerves internally, so you can't really feel that the disc is beginning to wear out or get damaged until it becomes severely damaged to the point where you can't reverse it. So it's really important to get this stuff early, but again, if you have progressed and advanced disc disease, what we're going to talk about can also make a pretty big impact. The disc itself is an active tissue that contains significant mechanisms for self-repair. That's really important. Let me repeat that again. The disc itself is an active tissue that contains a significant mechanism for self-repair. And what that mechanism is that the disc has a natural pump mechanism which keeps the disc hydrated and healthy. And we're going to go over that. So here goes the illustration, again, showing you the normal disc on top. And as it gets degenerated, bulged, herniated, and then it gets thinned and totally deteriorated. And that's actually the sequence of events when you get a disc injury. right, so what is a bulged or herniated disc? A bulged or herniated disc is when the outside of the disc, which are the fibers, the fibrous material, tears, either through deterioration or through a sudden injury. This outside material to the disc can actually tear, and what will happen is the inside material will start to leak out and put pressure on the spinal nerves. And if these nerves come out of your neck, the pain will go down your neck, shoulders, and arms. If that nerve is in your low back, or if that injured disc is in your low back, it could send pain into your butt or down your leg. And in this study over here at the University of Colorado, it showed that even the weight of a dime on a nerve can cause 60% of dysfunction. So it doesn't take much pressure on a nerve to cause pain down your leg and to cause your leg to go into spasm and to cause that nerve to actually dysfunction. So over here we have an MRI. And let me just orient you with what we're looking at. So this is an MRI of a low back if you're looking at a person from the side. Over to the left here is the person's abdomen, and over to the back here you could see their spine. And this white area is the spinal cord, specifically the spinal fluid. It comes out white. Fluid comes out white on an MRI. So in a healthy disc on an MRI, what you're looking at are two things. You're looking at color. You want it also to be kind of light in color. That shows you that the fluid is contained within the disc. And you're looking at the height of the disc. You're wanting that disc to be nice and tall. So you want plenty of space in between each bone. See, this is a good healthy disc. The one above is. Look what happens in an unhealthy disc. In an unhealthy disc, first of all, the disc height is decreased. The color is darker. And most importantly, over here you could see the indentation up against the nerves. And this, my friends, this is what causes pain. This is called a bulged disc, and it's bulged and sandwiched, and you could see it kind of pushing up against the spinal cord. And up top here you could see that it's supposed to kind of sit up flat up against the spinal cord. Over here it bulges. So this is an unhealthy disc. So when you get an unhealthy disc that starts pushing on a nerve, what happens is people start to experience pain. If it's in your low back, into your butt, or even down your leg, all the way to your foot sometimes. It could be pain, it could be numbness, tingling, it could be muscle spasms. And the general term for pain down your leg is called sciatica. So all disc injuries have one thing in common. They have lost their innate ability to keep itself healthy and hydrated. In essence, the pump mechanism has failed. So when a disc gets injured, one thing always happens. The pump mechanism gets turned off. And this pump mechanism is movement driven. So what happens is when you're kind of bending, twisting, turning, walking, the disc will start to move and pump if it's healthy. And that pump mechanism will start to draw fluids, nutrients, and hydration in, and all the other properties out. So there's this constant circulation of fluids. Failure of the pump mechanism results in biochemical changes causing disc conditions such as bulging, herniations, or degenerated discs. So this is kind of a good illustration that shows you how the pump mechanism works, the pump mechanism in action. And you can see as we put weight onto the disc, it pushes out fluids, and when we decrease the weight and the loading on the disc, it actually draws in fluids and nutrients and oxygen because we're putting negative pressure on that disc. Again, when we take pressure off the disc by distracting the disc, that's when it starts to draw in fluids, starts to draw in oxygen and nutrients to keep that disc tall and healthy. So when you get a failed pump mechanism, it leads to the condition, which leads to the symptom. And a failed pump essentially means that you have a loss of circulation to that disc. So what causes the pump mechanism to fail? Why does this pump mechanism fail in the disc? Well, there are a few reasons as to why. Stress, physical stress, chemical stress, emotional stress. Physical stress can entail some kind of trauma, accident, aging. Chemical stress means smoking, drinking, a lot of pain medications or prescription meds. They could cause tissue damage. And also emotional stress. When you're stressing, it causes different hormones to be secreted, which can cause a breakdown of tissues. Another big reason that we see in our clinic is people that have desk jobs and sit for too long. Their discs aren't moving and they're bearing a lot of stress, so they're going to wear out prematurely. Poor posture is another thing that causes the pump mechanism to fail. And also being overweight causes the pump mechanism to fail by putting too much stress on that disc. So it doesn't take much of being overweight to actually shut down that pump mechanism. 20 pounds overweight can already lead to a ton of pressure on that disc. And that's another thing that you're going to want to get under control if that's an issue with you and you also have a disc injury or disc problem. So how's back pain currently being treated? What happens when you go to the doctor? And is it working? So what happens when your back gets injured? You're going to go to the doctor. The doctor's going to give you some pain medication. If that doesn't work, they might send you to physical therapy. And then if that doesn't work, you might get some epidurals, cortisone injections, which could temporarily numb and relieve the inflammation. And then if that doesn't work and you're in a lot of pain, you might get prescribed surgery. Some people go into chiropractic to get some movement in the spine, and some people go into acupuncture to kind of take the pain down. But what do all of these things have in common? All of these procedures do not specifically address the disc condition. So let's talk about what they do. Painkillers. They temporarily decrease the pain. They don't affect that disc condition that's causing the whole pain. They don't affect the source of the problem. So what happens when you take painkillers? There are a lot of side effects, and you could read them all over here. There's too many to read. Nausea, vomiting, headaches, diarrhea, ulcers. You can't be on these for too long. This is meant to be a short-term fix. So, this is not the end-all when you have a back issue. You need to figure out what's causing that back problem. Physical therapy. There are good parts to physical therapy. Physical therapy is great, but it's all about when you incorporate physical therapy. If you do have a disc problem, it's good to stretch and strengthen around that disc, but that's only when you stabilize the disc. And we're going to talk about when to incorporate physical therapy, because right now in most cases it's prescribed way prematurely. So we'll talk about when to prescribe PT, and it's certainly not on an unstable disc. Let's talk about epidurals and cortisone injections. So cortisone injections are a powerful anti-inflammatory drug that can reduce swelling. You get injections into the spine and disc that are typically using corticosteroids. But the problem with cortisone injections is that while it decreases pain, what it does, it actually speeds up the breakdown of the joint. And that's why you can only have 3 per year. If there was no side effect, they wouldn't limit you to only having 3 in a 12-month period. Corticosteroids are the most abused and dangerous class of drugs, according to Dr. Jeffrey Levy, a well-respected specialist. Some of the other side effects with epidurals and cortisone injections, you get osteoporosis, up to 8% loss of bone in 4 months. That's a lot. Low doses for even 1 year can cause cataracts. It elevates your blood sugar. Any diabetics out there? It can suppress your ability to fight infection. Results in an increase of degenerative joint disease, irritation of the neural lining and spinal cord. So these things, they do come with their side effects, folks. They're not without any risk. They're not without any risk. Anything invasive like this comes with its risks. All right. Let's talk about the granddaddy of risky procedures. Let's talk about spinal surgeries. And you know what? Before I get into this, I want to let you guys know that there is a time when people do need spinal surgery. But that is only when they have exhausted all of their non-invasive options. That is definitely not the first go-to whatsoever. So I'm just going to run through this picture. It's kind of a nasty picture of a spinal fusion, and the reason that I show it is just to show you guys that this isn't something small. There are micro procedures, but a lot of people get spinal fusions, and boy, these are so invasive, so invasive. So I'm going to run through it really fast here. There it is. They're putting rods into this poor person's spine, and they're fusing the back, essentially, to stabilize. This is how it looks on X-ray. This is how it looks on X-ray. You can see the bolts and the screws, and you better believe this person's life is definitely not going to be the same after this. This is not something that people should jump to right away. And even a lot of spinal surgeons, they really carefully screen for good candidates. And some of them are more liberal than others in taking patients on. So it's very important for you guys to be educated. Here's some spinal surgery statistics. And again, this is not to bash spinal surgery. These are just statistics to inform you guys. And again, there is a time when this type of thing is needed. Nearly 1 in 50 back surgery patients die within 3 years of surgery. That's a lot. Death rates are significantly higher when meds are involved, which is almost all the time. Mortality is 7-fold when cage devices are used in conjunction with analgesics. Dr. Eugene Carrigy, well-respected surgeon out of Stanford, performs spinal surgery only on a very select group of patients who he very carefully screens, and his conclusions were that less than 25% will be completely successful even after carefully screening them. So 25% success rate. I would say it's about 25 to 50. But geez, that's like flipping a coin, even worse, nothing to jump at right away. For the majority of the patients, surgery does not have a dramatic impact on their pain and mobility. Boy, having gone through all that, and if surgery does not have a dramatic impact on your pain or mobility, it's pretty upsetting. A patient's prospect for a future free of back pain is fairly poor, according to Dr. Carrigy here. And this is from a well-respected spinal surgeon himself. Let's talk about the cost. The cost for back surgery in the USA, $6,000 to $8,000. With an endoscopic surgery, $60,000 for a spinal fusion, and north of $80,000 for a laminectomy. Then you got all the other costs, the prescription meds, the physical therapy after, the hospital fees, the lost wages, and the post-recovery time, and the time lost, the time lost being with your family and being on your feet and living life. So big consequences, but again, there is a small group of people where this is their only choice, and we're glad that there are great doctors around to offer this when we are in need. But you have to really be careful in deciding when you jump to something like this. So it's good to have, but definitely not something that you jump into. Well, a lot of people will say, well, my insurance covers it, so why not go for it if it's going to be covered? But with a 20 to 30% copay, you're talking $11,000 to $16,000 out of pocket, even if your insurance covers it. So pretty expensive, pretty invasive, not the first go-to. I think I made my point. So a lot of surgeons, some surgeons will say that they have a higher success rate than 25 to 50%. 95 to 98 is a little high. I've heard 80% success rate, and that's still high. I think the reality is that it's closer to 50% success rate, with a high risk of complications. Again, infection, nerve damage, permanent disability, death even being one of them. So that's your spinal surgery here. So again, are we on the right track? After reviewing all the options, statistics, you got to think about it. Are we on the right track in treating back pain? And again, what else is out there? And we are going to go over another option for disc injuries that's out there. So what we have put together, Dr. Frino and I, is called the disc restoration method. Disc restoration therapy is a 5-step approach to healing and restoring function to the disc, which is the source of pain and problems in the majority of back cases. So the 5 steps are spine, spinal decompression, non-surgical spinal decompression, physiotherapy, intersegmental mobilization, nutritional support, and lastly, exercise rehabilitation. You see, exercise and PT comes in after you stabilize. So we basically attack this issue in 5 different ways, in every single way that might be weakening the disc. Let's talk about spinal decompression first. What is spinal decompression? Spinal decompression is a medical device that was developed by Dr. Alan Dyer, medical doctor, who's the health minister out of Canada. Dr. Dyer also developed the defibrillator. And the protocol was developed by a neurosurgeon out of Harvard, Dr. Norman Shealy, who also contributed to the invention of the TENS unit. So spinal decompression is spinal distraction without muscular contraction. So as opposed to traction, which just pulls at your spine, causing the muscles to eventually fight back, impairing the negative pressure on the disc, spinal decompression kind of tricks your muscles into relaxing gently so it can actually decompress the spine, and we'll get into some details. Spinal decompression can target one specific disc or a couple discs at a time in the same geographic area. So again, as opposed to traction pulling on your whole spine, because of the computerized pull of spinal decompression, it can target one geographic area, and it can really target that one disc that's injured or the couple discs that are injured. It senses muscle contractions 4,000 times per second, which results in less muscle spasms and guarding, and it creates a negative pressure within the disc that causes that vacuum effect to suck in the water, oxygen, and nutrients and the disc material, if there's any bulged material, back into the disc, allowing the disc to heal from the inside out. So basically what this does is it restores the integrity of the disc. It doesn't change it around or cut it or anything like that, or artificially decrease the inflammation. It basically restores the natural function of the disc, allowing the normal healing process to take place, and with that comes pain relief. So, decompression of the spinal discs produces a negative pressure, a negative 160 millimeters of mercury within the disc. And during a study published by the Journal of Neurosurgery, researchers placed a pressure sensor in a disc while undergoing decompression and found that the disc pressure had dropped to a negative 160 millimeters of mercury. So what kind of pressure do we put on the disc? If we bring it down to a negative 160 millimeters of mercury, what causes a positive pressure on the disc? So when you bend something over and pick up a heavy item without using your legs, that's a big one. That causes a positive 800 millimeters of mercury on that disc. If you use your legs, it gets cut to a little more than half. If you're standing up straight, just regular body weight, you have a positive 100 millimeters of mercury of pressure on your disc. When you're laying on your back, just laying on your back, face up, it'll cause a positive 75 millimeters of mercury of pressure on the disc, and laying face down causes 40. Spinal decompression causes a negative 160 millimeters of mercury, causing that vacuum effect and the influx of fluids to actually heal that disc. So how does it work? What happens is through that negative pressure, you get water, oxygen, nutrients back into the disc, which fixes the pump, which basically restores your circulation, then gets to heal and repair your disc. So spinal decompression can make a physical change to the discs and a true change in the condition. It rehydrates the disc, that increases the disc height, it reduces the disc herniation size, it takes pressure off of the compressed nerves, and most importantly, it recreates that pump mechanism of the disc, all resulting in less pain, more function, and a better quality of life. Is it safe? It's so safe that mom goes on it. This is Dr. Ferrigno's mom having a gentle spinal decompression treatment, probably taking a nap. How long does it take? You're on the table for about 25 to 30 minutes, and all of the studies are based off of a 20 to 25 visit protocol over a 6 to 8 week period. So you are actually in the office anywhere probably for about 60 minutes, because there are some pre and post therapies before you get onto the table. And most patients see results, symptomatic results, within 2 to 4 weeks. You start to feel better. And then beyond that, the disc repair mechanism just gets kicked into place. The other part to disc restoration therapy is physiotherapy. We use electrical muscle stim, which generates blood flow to the area, begins the healing process, reduces muscle spasms, muscle contractions. In a couple of our offices, we use cold laser, which increases the energy within a cell that speeds up tissue healing, reduces pain and inflammation. You get a lot of athletes now using laser. The other part that we use is intersegmental mobilization. Intersegmental mobilization gently restores motion to the disc. And remember, when there's motion to the disc, you're getting that pump mechanism to work, causing that circulation of fluids. You also get nutritional support. We have formulations that speak to that disc material to actually heal the disc. And this is a different formulation than you'd have for your hip or shoulder joints. The disc is a very specific type of structure, and it takes very specific nutritional support. And that's something that we provide. And then finally, we use exercise rehabilitation now to strengthen around that newly healed disc. That's when you want to start using rehab. You don't do the rehab on a sick disc. It's like building a beautiful house on a poor foundation. So what types of treatments actually work on the disc? From this list, the only one is surgery and non-surgical spinal decompression. Again, we talked about surgery and how invasive and risky it is, the low success rate, and how it should be a last resort. Spinal decompression should definitely come first. And those are the two things that actually change the anatomy of the disc. So, what conditions does disc restoration therapy treat successfully? Herniated discs, bulged discs, degenerative disc disease, spinal stenosis, facet syndrome, sciatica, brachial neuritis, chronic neck and back pain. So over here we have a video of a medical doctor that refers for spinal decompression, and she liked the results that her patients were getting and decided to let us know, and I want to play what she had to say.
Hi, my name is Dr. Jamie Newer, and I'm a sports medicine doctor and medical director at Cardinal Medical Group in Palo Alto. Throughout my years in practice, seeing many severe spinal disc cases, I've come to the realization that the medical community as a whole does not have a good track record in treating this disease. I was first introduced to disc restoration therapy by Dr. Vitaly Mosesin a few years ago. Since then, most of my disc patients start there before any invasive procedures are considered. Since utilizing spinal decompression and disc restoration therapy for my back patients, I've been able to offer a non-surgical option that is science-based and very effective when my patient is a good candidate for the therapy. In my opinion, this is a step in the right direction.
So as you can see here, Dr. Newer is a big fan of spinal decompression amongst other doctors, and really appreciated her taking time and letting folks know of her opinion. It'd be great if a lot more doctors were aware that this type of option exists. Maybe we'd have less failed back surgeries or less people in chronic bad shape here. So over here you see a pre and post MRI, before disc restoration therapy, spinal decompression, then after. You could see on the left that disc material had bulged and pushed into the spinal cord. This is probably causing a lot of pain. And over here on the right, you could see that the disc material had retreated off of that spine significantly enough to where it's causing a lot less pain. Here is a study that showed that had 219 participants with a herniated and deteriorated disc. 86% showed improvement with spinal decompression. Only 2% relapsed within 90 days. Not bad. Here's a Mayo Clinic study where the average pain score of the participant was 6.4 out of 10. They had pain for more than 6 months, and 20 treatments of disc restoration therapy were given over 6 weeks. Let's see the results. Significant pain relief, 88.9% of the patients. That's great. Average pain decreased from 6.4 to 0.8 out of 10, almost non-existent. They required fewer medications, there were no safety issues, and there were no adverse effects. Here's a long-term study 4 years later where 91% resumed normal activities, and over 80% showed 50% or greater pain reduction at the end of a 4-year study. So does it last? Yes, it does last. Greater than 50% still had a pain level of 0. So how do we determine if you're a good candidate? Because not everybody is. So the way we determine if you're a good candidate is through a comprehensive consultation and exam. We take you through a thorough orthopedic and neurologic testing. We analyze radiographs in the way of x-rays or MRIs if you have them, and if we think that you need them, we'll let you know as well. And then after we get all this information together, we decide whether or not you're a good candidate and whether or not you'll have a good outcome. And for the candidates that we choose, we have had an average of about a 75 to 80% success rate. So about 8 out of 10 people get better after they're carefully screened. And as you can see from all the other statistics, with all the other procedures that we covered, an 80% success rate in the medical world is pretty darn good. So, because it's our mission to help as many people as possible and just really educate them on back pain and the best options to care for their back condition, back or neck condition, we have a special offer. We are offering to give you guys a consultation, detailed evaluation, a review of your x-rays, MRIs, and all medical records with either myself or Dr. Frigno. We usually charge $200 for this. If this is something that you guys feel that you can benefit from, if you were on this webinar, we'll do it for $45. Call that number below, 1-855-322-3472, and mention that you guys were on the webinar, and we'll pass that special deal down to you guys. Again, depending on what you do, it'll dictate how you are going to feel and the outcome of your back pain. If you're you decide whether the back pain becomes chronic or it's something that you get control of in a timely manner. And me and Dr. Frigno speak a lot about how we wish we could have gotten to some of these folks earlier and how much pain and suffering they could have avoided. So if you guys are considering this, take us up on this offer, at least to see if you're a good candidate. Again, the number is 855-322-3472. This webinar was brought to you by Bay Area Disc Centers, and we hope to see you soon. Take care.